Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, April 14th. I'll now turn things over to Dr. Fitzgerald for an update on the latest numbers here across the province.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have 3 new cases of COVID-19 in our province, all in the Eastern Health region and all travel related. One is between 40 and 49. One is between 30 and 39, and one is under 20. The total number of cases in our province is now 1,034, and there are 14 active cases. No one is in hospital due to COVID-19, and a total of 127,835 people have been tested to date. While Western Health continues to investigate the source of a recent cluster in the region, so far, all the identified cases are epi-linked, meaning they are contacts of a case and can be traced back. There was an excellent response to the call for community testing, and results have been reassuring to date, and means we have no indication of community transmission at this time. We are also aware that there have been cases identified in the area of Quebec that borders Labrador West. The Medical Officer of Health for Labrador-Grenville Health is working with Quebec health officials and monitoring the situation closely. Public health assessment deems the risk to the community is low. We are, however, making testing available to anyone who visited restaurant and bar establishments in the Fairmont area between April 5th and 9th out of an abundance of caution. We continue to assess the effectiveness of our public health measures, epidemiology, and risk level. Given that there has been no evidence of community transmission since we began reopening, we are now ready to increase the size limits for formal gatherings. Effective 12:01 Saturday, April 17th, we will return to a maximum of 100 people for formal gatherings. As a reminder, this is not for social or informal gatherings. Informal gatherings should be limited to your close contacts in your steady 20. The 100 maximum applies to formal gatherings that are run by a recognized business or organization and would include funerals, burials, weddings, and religious and cultural ceremonies and services. Large venues with normal operating capacities of 500 people or more may request approval to host larger gatherings by submitting a proposed operational plan to the Department of Digital Government and Service NL. Larger venues with previously approved operational plans may resume hosting larger gatherings in accordance with their plans, provided that they now follow the new mask requirements where individuals keep their mask on when seated and not eating. Returning to larger gatherings must be done in conjunction with strict adherence to public health requirements. This means no one should attend a gathering if they are unwell, even with mild symptoms. There must be 6 feet of distance between individuals or household bubbles. Attendees must wear a mask at all times when not eating or engaged in high-intensity activity, and everyone should ensure proper and frequent hand washing or use of hand sanitizer. Today, we are also announcing changes for essential workers entering the province. Essential workers are necessary for the continued functioning of our communities. They are important to maintain our province's critical infrastructure and equipment, the delivery of goods, food supply, and the delivery of patient care. Before now, essential workers were permitted to proceed directly to work and isolate at all times when not working in the province. Given the higher incidence of COVID-19 in other provinces and the increase in variants of concern, the risk of COVID importation into Newfoundland and Labrador remains high. So effective Monday, we will be implementing new testing and self-isolation requirements for essential workers to further reduce the risk of COVID-19 spread while allowing these critical services to continue. This protocol requires that essential workers be tested upon arrival to the province, and before beginning work, they must self-isolate until they receive this first negative test result. Essential workers only staying in the province 2 days or less will not require an arrival test, but are still required to self-isolate when not working. If the worker remains in the province, they will be tested again at day 7, 8, or 9, and again near the end of the work isolation on either day 11, 12, or 13. Testing can be arranged by completing the online self-assessment and testing referral form, and the form can be completed up to 7 days in advance of arrival to the province. If at any point during the 14-day work isolation period, a worker develops any COVID-19 symptoms, even if the symptom is mild, testing must be arranged. This testing must be arranged even if a negative test result was recently received. Workers must not report to work if they have symptoms. It is important to remember that an accurate test result depends on the viral load, which is the amount of virus in your body. And sometimes it takes time for the viral load to build up enough for the test to detect it. If the swab is taken early in the course of the illness, it could be a false negative. A negative test is not a guarantee. And it is for this reason that rotational workers, and now essential workers, are required to have a test on day 12, before the self-isolation period is complete. Not only is this outlined in our special measures orders, it is important for the protection of our community. We have seen people test negative in the first half of self-isolation and positive later in the course of their quarantine. I know that there are residents in our province that travel out of the province for essential work as part of their job and continue essential work when returning home. These individuals are permitted to perform their essential work and abide by the testing protocols, but must isolate away from household members upon return for 14 days. They are not able to avail of modified self-isolation for rotational workers, as a person cannot be considered both rotational and essential. Different testing and isolation rules will apply for truck drivers, given the duration they spend in our province, and this information will be available on our website. Household members of essential workers and truck drivers in the province may avail of testing on day 7, 8, or 9 after the worker returns to the province, if they wish. To assist employers, we are introducing a new essential worker work isolation letter, which is available on the COVID-19 government website. Employers must complete this form and provide it to their employee. The essential worker is required to show this letter to border officials upon arrival to the province. It will confirm for us that their work is essential. Pilots and other air crew are not required to have this letter. This new protocol does not apply to essential healthcare workers in regional health authorities, as there is an existing process in place for these individuals. We reached a significant milestone in our immunization program, with over 100,000 people having received at least 1 dose of vaccine. While it took us almost 4 months to reach this number, we expect a much shorter period of time to reach the 200,000 mark. And we continue to receive a steady supply, and regional health authorities are working diligently to get each and every dose administered as quickly as possible. We anticipate that we will be able to begin offering vaccine to those aged 65 and older in the next 2 weeks. The timing may differ by region, and each regional health authority will send public notifications when these appointments are available. Vaccinations are also being planned for those in congregate living settings and those that are clinically extremely vulnerable, as outlined in our vaccination plans. Additionally, this past week, we released an estimated timeline for when individuals may expect to receive their vaccine. This is now available on our COVID-19 website under the link for COVID-19 vaccination information. For anyone that has received their first dose, please make sure you continue to follow public health guidance, as you are not yet fully protected. As a recap, for those who may have just joined, we have 3 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 1,034. There is no doubt that the future is promising, but how it unfolds is up to us. We need to keep our eye on the end game, which is staving off a COVID-19 wave until we have a significant proportion of our population vaccinated. We are so close. So we need to keep up our proven public health measures, follow the recommendations, and stay the course. And hold fast, Newfoundland and Labrador. Thanks very much.
Well, thank you, Dr. Fitzgerald. I'd also like to thank the people on the West Coast for their patience and in helping us navigate the situation over these last few days, in particular to independent MHA Eddie Joyce, who helped us navigate some of this. Please continue. If you've signed up for a test out there, please show up and get the test. All of this helps us in making our decisions, helps Dr. Fitzgerald and her team in making their decisions moving forward. So thank you. The number of COVID-19 cases in our province still remains low. Please keep up the great work. We want it to stay this way, and that is partially responsible to all the sacrifices we're making. And every day, the number of people getting vaccinated continues to increase. Last week, we hit a major milestone in Newfoundland and Labrador. Over 100,000 people received their first dose, and that number is increasing by the hour. Today is also a big day for high schools across the province as many students return to class. I'd like to wish you luck as you near the end of this school year. And for some who are preparing to graduate, this is a special time indeed. To the teachers, administrators, and support staff, thank you. Thank you for your continued professionalism during these trying times. This week, we had to adjust to the timeline with respect to the Atlantic bubble. But please know that this is being done to protect each and every person, not just in our province, but across Atlantic Canada. Your health and safety is our main priority. As much as we look forward to being able to see others in the bubble, the number one priority is your health and safety. Of course, this was done after speaking with my counterparts across the Atlantic region. Earlier today, I reached out to Ontario Premier Doug Ford. They are going through a tough time there, and I offered whatever support we can during their time of need. I know many of us have friends and family in that province, and the connection between Ontario and Newfoundland and Labrador is quite strong. We all want things to return to normal, and with the continued rollout of the vaccine, we are getting closer. Now, while we won't get to see our loved ones outside the province in the Atlantic region just yet, it's great to hear that Dr. Fitzgerald and her team at Public Health have increased the allowable numbers for gatherings. This will come as very good news for many, including faith-based groups who are eager to worship together. All of this is positive news. But please remember that while we are able to move about more freely than others, we can only continue to do so if we all continue to abide by the basic rules of public health, wearing a mask, washing our hands, and keeping a safe distance. So please, let's keep it up. And with that, I'll turn it over to Dr. Haggie for some brief remarks. Dr. Haggie?
Thank you, Premier. 14 active cases, double digits. A reminder that COVID is still with us, and our plan is life with COVID-19. And we need to continue, as Dr. Fitzgerald has said, with public health measures, even as the vaccine rollout continues and the vaccine numbers increases. Both Dr. Fitzgerald and the Premier have referenced the milestone of 100,000 doses and then 100,000 people with first dose across the province. And by the end of this week, we anticipate having delivered 140,000 doses to the people of this province. The rollout of vaccine into phase 2 was accelerated by the availability of AstraZeneca and allowed for a parallel stream. But we are starting to work our way now down through phase 2. And as Dr. Fitzgerald referenced, 65 to 69 will be available next week in Central Health, possibly by the end of this week, and certainly across the other regional health authorities by this time next week. For those who have had difficulties with mobility and are housebound, we're still hearing some concerns from Eastern Health. I can reassure you that they now have the list. They have identified all of those individuals and will begin in Eastern Health starting to visit and vaccinate over the course of next week. Western and Central Health are advanced already down this road. So again, until we reach a threshold of people vaccinated, a large proportion, we still have to consider public health as our first line of defense against COVID-19. So again, keep your distance, wear your mask, wash your hands, use a hand sanitizer, and as Dr. Fitzgerald says, hold fast. Thank you very much, Premier.
Well, thank you so much, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and one follow-up per round. Following this, I will ask each reporter if they have one final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Thank you, Dr. Fitzgerald. I'm wondering about the new rules for essential workers. How many cases have we seen of essential workers testing positive, and have there been instances where they have spread it because they have been, for example, working around other people, things like that?
Yeah, so at the moment, I can't tell you the number right off the top of my head over the course of the last year, but we have had a couple of instances, and certainly, you know, we haven't seen a lot of spread in those situations, which has been really good. We're trying to be proactive here to prevent that from happening. We know with the variants of concern, there's a lot more spread. We're seeing more disease in the provinces elsewhere in the country. So this is really about trying to be proactive and prevent that from happening.
And as we move through phase 2 vaccinations, for example, Labrador Grenfell Health is now allowing anyone in that phase. What sort of proof is required, for example, for folks who are clinically vulnerable or for essential workers? They're now allowed to go and book their vaccine, but what's preventing anyone from saying, I'm an essential worker, for example?
So with regard to clinically vulnerable groups or persons, certainly most of those would be able to be identified, and the regional health authorities are, you know, in the process of identifying who those people are, and will be reaching out through either through their physicians or healthcare providers, or through you know, programs that they are accessing in the RHAs. So we have some methods in place for that. With regard to other people who were vaccinated, certainly at this point, we are expecting that only people who are in those groups would be coming forward. With regard to certain groups, we do have the ability to confirm with you know, looking at travel entry and things for people who are leaving the province for work or coming back and forth for work. You know, the expectation is that people would be honest. The regional health authorities will have plans in place.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Premier Ferry, you tweeted not long ago about speaking with Premier Doug Ford in Ontario, saying you'd offer any help that was needed. What specifically will that look like? Is it giving up some of our vaccines to them? Is it providing physicians from Newfoundland and Labrador? What does that help look like?
Well, I just chatted with Premier Ford, and he's getting briefed this afternoon on what their needs are, and I asked him to reach out after he had a more substantive understanding about what they would be requiring moving forward, and I offered whatever assistance we could provide within our capacity. Of course, Ontario is much bigger than we are, but I think that this needs to be a Canadian effort in protecting the centre. So I asked him to come together with what he needs, and if we were able to meet any of those needs, recognizing our own limitations, then we'd certainly be willing.
Right. Dr. Fitzgerald, a few patients now who have received transplants and been vaccinated being told by their specialists that they need that second dose in the time frame put out by the manufacturer, so 21 or 28 days, depending if it's Pfizer or Moderna. Who do they contact? How do they go about making sure that they get that second dose in the time frame needed for them?
So our recommendation at the moment is that, you know, we're still holding with the 16 weeks. Certainly, that evidence is being reviewed at the moment. NACI, our National Advisory Committee on Immunization, has not made any changes with regard to narrowing that interval, and so we will be following the advice from that committee. Certainly, if, you know, once we get through those groups, we will, once we get through vaccinating everybody, certainly those who are deemed to be at higher risk and where there may be concerns about the length of time of response, they will be targeted to receive that second dose initially faster. So they will move up the queue, I guess, so to speak, to get that second dose to narrow that interval as much as we can once everybody is done.
Okay.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. There was a case reported last Thursday, I believe it was, in the Eastern Health region that was under investigation. Just wondering if we could get an update on that. Is that case still under investigation?
Yes, so the Eastern Health has been following that investigation, and unfortunately sometimes we are not able to find the source of an infection no matter how hard we try. And it is my understanding that Eastern Health is still following that case and still looking at potential sources, so it remains under investigation.
Thank you. And Premier Fury, with the Atlantic bubble news yesterday, I've heard some concerns from people who are questioning why instead of opening to all the Atlantic provinces, why wouldn't we say open up to just one province, say Nova Scotia or PEI, in the interim until cases calm? Why are we going with this all or nothing approach?
Well, certainly those are still things that we're evaluating. We haven't made a firm decision on the relationship with Nova Scotia just yet, but yesterday I think it was prudent, after talking to all 4 Atlantic premiers, that the concept of a full bubble was not entertained, and we agreed on the call last night that that should be the path forward. But we're looking, as we always do, about towards the epidemiology and following the clinical evidence and the real world evidence as it exists and in real time. So we try to predict, but sometimes you can't make that mark. So we are still entertaining all options, but right now I think it's, you know, as a bubble itself is not on.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, good afternoon. The indications are that the pre-registration system for those 70 and over did not work very well, considering that it's now just been abandoned. Are you still planning to stick with the pre-registration for the upcoming groups?
Thanks, Peter. The pre-registration system, I wouldn't characterize it quite that way. I think there were challenges, and I think some of them, quite frankly, have been software related, with the booking of the subsequent appointment when the URL opened up and access to that. For the present, the reason that the RHAs have issued an open call is as much about the fact some of the vaccine uptake combined with some of the extra deliveries of vaccine that we've had have enabled that to happen. In a sense, the view from a couple of the RHAs for sure is that they have identified all they can through the process of pre-registration and gone back, but they are concerned that there would be people who for one reason or another have not quite got an appointment. So hence the open call there. In terms of the other for example, those people actively receiving chemotherapy who could be vaccinated at an RHA facility because they attend fairly regularly, and therefore it's daft to drag them off to another appointment somewhere else. In terms of identifying specific groups, when you have an open call, there are means to identify them. Your MCP number, for example, is hard-coded with your date of birth, so age can be checked very easily. We'll be issuing essential worker letters to essential workers. Rotational workers get entry numbers. So there are pieces of evidence that can be sought to verify these with an open call. But we're getting to the stage now where that is feasible simply because we're getting north of 29,000 vaccines a week, and come May, that number could theoretically double per week. So it's a change because of the way the circumstances have changed.
Okay, thank you. And I'm wondering if there's a reason that priority groups such as teachers, vocational workers, if they fell into the right age category, why are they not being given first dibs on the AstraZeneca vaccine?
Sorry, but anyone who's in the age category can get an appointment for the AstraZeneca vaccine.
Okay. But they're not being prioritized?
No, it doesn't matter. It doesn't matter what their profession is. Anyone who's in the age category can get can go online and get an appointment for the AstraZeneca vaccine.
Okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
A question about the concerns that we've seen around AstraZeneca and pausing it for younger age groups. When you look at the likelihood of blood clots, it's more likely that people would get a blood clot from flying, for example, or if they're on the birth control pill. Or smoking is another thing. So why are we pausing the vaccination rollout for those age groups when we know that there is, other than the blood clot issue, we know that they are safe and we know that they're effective against this disease?
So whenever we bring a new vaccine onto the market, whenever we bring anything new onto the market, really, from a medication point of view, we need to make sure that, that we're not having any untoward effects that we hadn't anticipated. So this is part of the vigilance that goes with monitoring these vaccines. And so the evidence that we saw initially indicated that it was perhaps a younger age group that these side effects were happening in. And so based on that, we paused until we could find more information. And, that information is still being sought. There's a lot of review being done. There's a lot of investigation being done. And I suspect that when all of that comes, is reevaluated, and Health Canada has a look at all of that, and the National Advisory Committee on Immunisation has a look at all of that, those recommendations may change. This was what we did with the information that we had at the time, because obviously we need to ensure, the other thing we have to look at is that anyone in the age group could apply. There are some people in that age group who we might recommend an mRNA vaccine for in the 55 to 64 age group. When I said you could get an appointment for the AstraZeneca, there are some people who, because they're at a higher risk for severe disease, we would actually recommend that they get the mRNA vaccine. But if that's not the case, then anyone in that age group can get the AstraZeneca vaccine. Just need to clarify.
And I want to ask about wastage. Do we have any stats in terms of what percentage of the doses have been wasted? And what happens at the end of the day if there are a bunch of extra doses and because people didn't show up, for example? I know other provinces have had essentially a standby list where you can sign up and say, hey, I'm available on a moment's notice to come and get my jab to make sure they get used up.
The latest figures I have on wastage, that is vaccines that could not be administered for technical reasons, for want of a better word, is fractionally over 200 out of the 100 and that we're currently at the moment. It's a very small percentage indeed. For those people who don't go to a clinic and there's vaccine there, if that vaccine is at risk of being wasted because there's no one there to have it. There are standby lists, indeed, if you go right back to the beginning of our vaccination campaign, there were instances where in health facilities, for example, people kind of passing on the corridor, someone would invite them in and say, "Do you want your vaccine now? We've got some left over." So the instructions to the RHA, and indeed the attitude of the RHA, has very much been none of this goes to waste. If we have stuff left, we will find someone to give it to, either phone them or drag them in through the door.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. And looking at the timeline that was released by government for immunization, is it better to really look at it from an age category perspective, and knowing that a lot of those 55 to 54 would fall into some of these essential workers and things like that? So would we get a clearer picture if we just went by segment of population by age?
It's kind of a combination, I think, yeah. You can go ahead, Dr. Fitzgerald.
Yeah, so, as when we don't have a lot of vaccine, we try to prioritize because we're trying to get those most at risk for severe disease, and then most at risk for potential exposures. So, it's a balance of trying to get those people immunized, because they're the ones who we worry about the most. They're the ones most at risk for ending up in hospital, in ICU, or dying. And those are, obviously, those are things we don't want to happen. So, we do, there is a benefit, I suppose, to going through by age, but really we wanted to make sure that we were getting those people who were most at risk prior to us having enough vaccine available for everybody, to go down those age categories. Some of those, for some people, it may mean that we'll end up vaccinating them a lot sooner than if we had done it by age category, and for some people it may not. But nevertheless, we feel this is the way to go for it at this point, given our vaccine supply.
Right. And then looking at the timeline here, you say we categorize and we go by NACI in terms of those who are most vulnerable to contracting the disease and maybe not faring as well through it. But right now across Canada, jurisdictionally, we're seeing that 30 to 40-year-olds are being hit hardest by variants and are actually taking up most ICU spaces across Canada, which ultimately affects healthcare in itself. Are we looking to maybe move our vaccination plan a little bit to hit those age groupings that are being hit the hardest right now?
So we have to be careful when we talk about that, because there may be more than just the fact that this variant hits 30 to 40-year-olds more severely, that has wound up with more 30 to 40-year-olds in hospital. And part of that may be that more 30 to 40-year-olds are actually getting infected with the variant, and therefore you would expect to see more of them in hospital. We do know that this variant can make people sicker quicker, and we do know that it seems to be affecting younger people in the way that it affected, the original variant seemed to affect older people to some degree. But some of, the reason that we're seeing that trend right now may not necessarily be because of susceptibility so much as it is because we've immunized the older population as well, so they're not as susceptible to having severe disease, and the fact that that age in the population are the ones who are out, who are more mobile, they're going to work in bigger workplaces, and so they're more likely to contract the disease. So we do have to be careful and take it in context.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
People are telling VOCM that they have received a vaccine confirmation email, yet when they go to their appointment, their name is not on the list and are given a new appointment. We were told one security guard mentioned 20 people in one day. How often is this happening?
That's a good question. I don't have an answer for that because this is the first time I've heard of it. So I'd love to go and dig. If you have some information you could supply us, we'll go and look at that and see if we can find an explanation for it. Thank you.
And people have reported issues with trying to call back and change their vaccine appointment, and they're unable to change it because they simply can't get through. How many no-shows are we seeing, and what can we do to curb that?
The number of no-shows is variable. I do know that Labrador Grenfell have changed their approach on the basis that they've had a modest number of no-shows. By and large, on the island portion of the province, I'm not hearing that that is a significant problem, with the exception of some smaller rural communities last weekend or maybe the weekend before. So there is a phone reminder system that we have set up to certainly for people for second doses. We're ready to deal with those. In terms of the first dose appointments, we have not had a significant no-show rate. But if that does become a problem, then we do have automated notification systems as long as people check their email. Check the spam, because that has happened to a modest number of individuals for reasons I can't explain, and also provide a cell phone number, because we have a very robust texting system that provides automatic notifications. So these are all tools that the RHAs use on a regular basis.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Dr. Fitzgerald, are we any closer to understanding whether people who've been vaccinated can still spread the disease? That would seem to be a major impediment to loosening health and travel restrictions.
Yeah, the information is still ongoing, or the investigation, I should say, into that is still ongoing. I don't know that we have anything definitive at this time. We do know that certainly there is a protection from severe disease, and so that seems, when people aren't as sick, they may not have as high a viral load and therefore may not spread the virus. But it's the data out there right now is there's just not a lot of it, and I don't think any of it, unfortunately, is definitive at this time. A lot of it is observational studies, and so they are a little less robust when it comes to their ability to relate a cause and effect. So we're still looking. It's going to take a little bit of time. I know everybody is really anxious to know that, but I think it is going to take us a bit of time.
Okay, thank you. Premier Fury, I'm wondering about the Atlantic bubble. I think some people are actually wondering whether it's wise to even go ahead at all, given the heightened risk of these variants of concern.
Well, as we've said from the beginning, Peter, this, we'll always evaluate the evidence as it evolves, and that includes our own local evidence, but also adjacent jurisdiction evidence. And even though I know we're all frightened about what's happening in Ontario and Quebec and British Columbia, if you look at the epidemiology in the adjacent Atlantic jurisdictions, save one area of New Brunswick, they were doing pretty good. So this is a decision that will be made on clinical evidence and epidemiologically based evidence. So I think, we've taken a 2-week or give or take a 2-week pause in this, and we will evaluate it should the evidence change, as we've said from the very beginning, and have proven that we would. So the public health and safety of Newfoundlanders and Labradorians is the number one priority, ahead of that of the Atlantic bubble. So that's the balance that we will take moving forward.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC. Do you have a final question?
I do. Dr. Fitzgerald, it's about testing numbers. When you look at Nova Scotia, for example, they've been consistently doing a lot more tests, even when you factor in the fact that their population is about double ours. What do you say to people who are concerned that we may end up going back to the same situation we had in February, where we're not doing enough testing in order to capture disease that may be out there in the community?
So I think, we have increased our testing, and we recognize that with the variants of concern, that testing is going to be more important for keeping our numbers low. So we have increased testing with rotational workers. We've increased testing now with our essential workers, and these are where our big risks are for importation. We have reduced our testing requirements regarding symptoms down to one symptom, so anyone with one symptom can get testing. We've certainly, looked at having community testing in areas where there's concern. So, in Corner Brook recently, we did it in the metro area. So these are, we're trying to tailor our testing strategy so that we're not just going out there and doing blanket testing, because when you get to that point, lots of times you end up with unintended consequences, and one being that you increase your testing turnaround time, and so then when you do need it for outbreaks and things like that, then the turnaround time is slower than what you really want. So we do have to be cautious with that. We also have to be cautious about false positives and the time that it takes public health to follow up those false positives. And certainly when you're in a situation with a low prevalence, you are going to be at high risk for having false positive test results. So all of that we have taken into consideration, and we will continue to reevaluate. So, and we are doing that as we speak. So, changes may come in the next little while.
Thanks.
Kellyanne Roberts with NTV. Do you have a final question?
Yes. As we head into hopefully warmer months and weather here, a lot of travel will begin to pick up just within the province itself, not including the potential of the Atlantic bubble. Many people looking to wonder how they can book their second dose for a different regional health authority. Say they have their first dose in Eastern Health, but will be on the West Coast come August or July. How do they ensure they get their second dose in that region where they are?
Routine with the RHAs at the moment is when you go for your first dose, you get your appointment and location for your second dose. The RHAs are working on the principle at the moment that people will change that and advise them rather than simply not show up. And so I think that mechanism probably needs to be made a little bit more robust. But at the moment, we are not opening up for a second appointment because we're providing that when they get their first shot.
Thank you.
Richard Duggan with BOCM. Do you have a final question?
Yes. How are we doing in terms of contacting Indigenous adults in urban settings, such as the St. John's Metro region, to get their vaccine?
The Eastern Health has reached out, and Public Health and Eastern Health has reached out, and they have identified those individuals that identify as Indigenous adults in the area. And my understanding is that they are moving through that group right now, and they have made contact with friendship centers and to provide culturally safe ways to be able to vaccinate those individuals. So, they have their processes in place and are working through those.
And Richard, I would just add that we have a weekly Indigenous call with all the Indigenous leaders across the province. And they've been very helpful in providing the information needed for the regional health authorities to reach out to these individuals. So we've got a great working relationship that has allowed us to facilitate this, and we'll continue to work with them to ensure that we reach all Indigenous adults throughout the province.
Thank you.
Peter Jackson with The Telegram. Do you have a final question?
Yes, I have a bit of a personal question. Dr. Fitzgerald, a couple of weeks ago, both you and I said we'd be quite willing to get the AAV vaccine. I put my money where my mouth was this morning, and I'm wondering whether you're in the right age group to actually follow through on your promise.
So I feel I've clarified that before, that I am not. However, if I was, I would get it. And, my husband is getting it on Friday. So, I feel he has put my money where...
Your mouth where his money is.
Anyway.
All right. Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us here today. We're doing well, but the only reason we're doing well is because of the sacrifices that each and every one of you make. So please continue to follow the public health guidelines. It will help us stay at this alert level. And I would like to, once again, on behalf of the province, extend our well wishes to our friends and family members throughout the rest of the country who aren't in as fortunate position as we are here today. So thank you very much for joining. We look forward to chatting with you next week.
Thank you, Premier.
Thank you.
Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely.